Have you ever found yourself unsure at the pharmacy between Loratadine and Desloratadine? They look practically the same, right? But there's an important difference that can change how well your treatment works. Today, I'm going to explain in just a few minutes which one works faster, which one lasts longer, and which one causes less drowsiness. Both are antihistamines from the second-generation H1 blocker class. In other words, they are used for allergic rhinitis, hives, and other common allergies, but with less sedation compared to older antihistamines like promethazine. Now, the key point. Desloratadine is the main active metabolite of loratadine. This means that when you take loratadine, your liver needs to convert it into desloratadine for it to work. Loratadine needs to be metabolized. Desloratadine, already active. That's why pharmacology studies show that desloratadine has a faster onset of action, greater potency, and a slightly longer duration. Both treat the same symptoms: sneezing, itching, runny nose, and hives. But desloratadine is often preferred when the patient wants faster relief, when hives are more intense, or when there's a history of poor response to loratadine. Effectiveness. Desloratadine is considered more potent and provides a more stable action throughout the day. Some clinical studies show better control of chronic hives. Speed of action. Desloratadine starts working in about 30 minutes. Loratadine may take 1 to 3 hours because it needs to be metabolized first. Side effects. Both have a low risk of drowsiness, but if sedation occurs, it's usually less common with desloratadine because it barely crosses the blood-brain barrier. Contraindications. Both should be avoided in cases of allergy to the active ingredient. Caution in severe liver disease, especially with loratadine, which depends on the liver for activation. Pregnant women, evaluated on a case-by-case basis. Category B, generally considered safe, but always with medical guidance. Drug interactions. Loratadine has more interactions, mainly with medications that inhibit CYP3A4 and CYP2D6, for example, ketoconazole and erythromycin. Desloratadine has almost no interactions because it goes through fewer metabolic steps. In summary, desloratadine is the more modern, active, and faster version of loratadine, with a lower chance of drowsiness and fewer interactions. But both are effective, and the best choice depends on individual response and your doctor's recommendation. If you enjoyed this clear and quick explanation, hit the like button and subscribe to learn more about medications in a simple way.